Welcome to another episode of Health Topics right here on Neyoflix TV. I'm your host Francisca, and today we are discussing a very sensitive yet crucial topic: breast cancer. October is Breast Cancer Awareness Month, and we want to take this opportunity to provide you with life-saving information. I have my guest, who is Miss Priscilla, a health practitioner from Obatampa Women Hospital. Welcome to our show, Miss Priscilla.
Thank you, Francisca. I'm happy to be here to share insightful point on breast cancer. And this is very, especially in this month, October being a pink month because of our boobs, the breast. And you know that early detection is the key. You detect it early, you manage, and it can save us from going a whole way around affecting our emotional issues and our financial aspects too.
Yeah. And to mark the event we are in our pink dresses, we know breast cancer affects millions worldwide, and its impact is deeply personal to many. Could you start by telling us about the costs associated with breast cancer, both physically and financially?
Well, I would add breast cancer doesn't only affect physically and financially, but also emotionally and to the immediate people in our lives. The cost of breast cancer is tremendous. To think of, the cost involved in the medical treatment, that is surgery, chemotherapy, radiation therapy. We have to, and even running some of the tests, that is taking a biopsy to really check if it's cancerous or not. And aside that, it doesn't only it might not be only your finances, but your immediate family members too, involving in your care, the kind of food you have to now be taking to help reduce the abnormal growth in the body, and the physical to losing your body parts. That is, if we are supposed to take off the cancerous breast, okay. And also, when you start this treatment, you should be able to afford the chemo or this kind of treatment. You have to be losing your hair. There will be a hair loss. You might not even have your body stature. You have to grow lean. And so, it's so overwhelming, and I think we should major on detecting it early, doing a lot of self-examinations to report any abnormalities so that it can be detected early. And if it's early detected, it can be cured. If not, and it's late, then we have prophylactic management, which we will just be managing the symptoms with some medications, but whatever it is, you're already going through it. And at the end of it, eventually, what we don't want to mention, it happens. That is there.
So, as she said, early detection can make a difference. Once you see some abnormalities in your bodies, what to do is to visit a hospital to check what is wrong to avoid breast cancer. So, Miss Kelsey, normally when we talk about breast cancer, most people refer to women. Is it only women that are affected by breast cancer?
That's a good question. Well, breast is not only found in women. It's not only women that have breasts. Men too have the breast cells, because it starts from utero. That is from the womb. When every baby or every individual was in the mom's womb. That's where the cell starts growing, okay, or developing. So when you come out, then it's already even situated. Then when the baby comes, we see that their breasts are situated on their chest level, like the chest line, okay. And so this thing starts from the armpit, the cells, the germination. If you should trace how it's developed, is from the armpit through to the midline, then they land on the chest. Some even go away, not on what we see on these the chest, the rib cage. Some can maybe if my breast is same, maybe yours might drop a little. Okay, so males also have the breast cells, and breast cancer comes about the abnormal growth of the cells of the breast, which end up forming a tumor. So we always advise the women or any individual when you're there. As for women, we encourage that after your menses, 3 days after your menses, you should do a breast examination. But for the men, you can examine if you should like that's the change. There's a change in the breast. If the color has changed, you found that there's an extra groove somewhere, like aside the black nipple that we all know. Okay, if there is stain that like when you touch it you feel pain, all these things are signs, so you should quickly report to the hospital. But in cancer patients, like if we get 1,000 of cancer patients, breast cancer patients, you will get a male like just 1%.
Yeah.
So it's very rare for men to get breast cancer, but it's possible a man can get breast cancer. But it's commonly found in women.
As our health practitioner said, men can also be exposed to breast cancer. It's not only in women, it can be found in men as well. So early detection can make the difference. Once you see that something is wrong, our men, please visit the nearest hospital to check. And Miss Kelsey, can you tell us the steps that both women and men can take to reduce the risk of breast cancer?
Yes. So the first point, what we can do to detect the breast cancer is regular self breast examination. Okay. And we also I'll come back to how it's done. Okay. We also have to watch our diet, and we should practice more healthy lifestyles, eating balanced diets, exercising, and also reporting any abnormalities that are being found in our bodies, especially around the chest area. We should quickly visit the hospital. So let me elaborate on the self breast examination. I mentioned earlier that we educate or encourage the women, especially, that after their menses, 3 days after their menses, they should do their self breast examination. And this is how it goes about. You first expose your breast. It shouldn't be in the brazier. You should see yourself bare chested. You stand in an upright position into a mirror. You should see very clearly and see if there is any dimpling. You should report. You touch it to see all around if there is any pain. You check the color. If there is a portion that is red, especially in the fair people, it's normally pinky or reddened part, or in the dark people, it will be black. Or if some people, the chocolate ones, you can see that the portion is reddened, you should quickly report to the hospital. So after checking the shape, checking if everything, like the nipple, everything is situated at the right places, fine. Then you move on to you hold your waist to see the size. Definitely, every female has different sizes of the breast, but the margin shouldn't be so great. The margin shouldn't be so great. Some could be their left breast that is smaller than the right, or some to the right is smaller than the left. After you put your one hand. So if I'm going to examine the right one, I'll put the right hand at my occipital, that is the back of my head. Then you use the pads of your fingers. You shouldn't be pressing it like this, but the pads, then you will massage in a circular motion, but it should be deep enough to be touching the bones. You should press deeply so that in case of any tumor or any growth that has been formed, you'll be able to detect it. Okay, and you start from your armpit. I mentioned earlier that it starts from the armpit. The growth, the cell starts from the armpit. Then that is the formation of the breast. If you follow that's what the studies are telling us. So you should massage by pressing deeply, touching the bone, from your armpit in a circular motion. Then you come to the breast, the tissues of the flesh part, the fleshy parts of the breast. You'll be massaged, not just pressing like this, but it should be in a circular motion with the parts of your fingers all round. Then after that, you also press on the nipple to see if there's any discharge. If you see any changes, like you see a discharge, you have to report. If you feel that sometimes people just hold it, some people do report to the hospital that they have done the breast examination, they feel that the mass is too much or there's a tumor. Sometimes if you just hold it this way without spreading for you to get a wider view, you will think that there is extra lump there's an extra lump in the breast, but probably it's just the muscles that are thickened. But the one that is an extra lump, like it feels harder, it's harder than just the mass in the breast. When you're done, you move on to the other one the same way, and you also check that if there's any discharge from the nipple. And I want to report to the hospital whether it's bloody discharge. If only you are not breastfeeding, to see a breast milk, any discharge that you see from the nipple should report to the hospital so that we can run some tests to see exactly what is actually happening.
Okay.
The men too can breathe, that's why they don't menstruate. So they can also do it to check if there is any extra lump in their breast, in their chest bone, anything, then they can report to the hospital for a checkup.
What's an excellent advice? Okay, thank you, Miss Priscilla, for these excellent advices. So as she said, self-examination is crucial, as well as regular checkups to avoid breast cancer development in both men and women. Also, we need to exercise and check our diet. It is very important. Thank you for shedding light on this important aspect. And it is crucial that we all take responsibility for our health. Thank you so much, Miss Kelsey, for being here with us.
Thank you, Francisca, for having me on the show to enlighten our women or the viewers on breast cancer. It's very important for women to do self-examination to help detect any abnormal growth in the breast and to report any unusual to the facility so that we can quickly treat it and also prevent those subsequent effects that affect our body's emotions and the immediate families.
Viewers, we hope you've learned something valuable today. Please share your thoughts and your questions in the comment section. Let's continue the conversation about breast cancer throughout this month of October. Don't forget to subscribe to our channel and share this episode with your loved one. Thank you, Mira Glam, for my makeup. You can reach her on 02712797771, and she's located at Medina, near Queen of Peace Catholic Church. Thank you for staying with us. Catch you same time next week on another episode.